Welcome back. Today is National Dermatologist Day, and the skin is the biggest organ when it comes to your body, so taking care of your skin is so important.
Joining us this morning is dermatologist Dr. Laura Houk. She is actually the chief of dermatology at MaineHealth. Thanks for coming on. Appreciate it.
Thank you for inviting me.
First of all, let's talk about how much of a problem is skin cancer and dry skin and things like that, we tend not to take care of our skin enough.
Totally agree. Skin cancer is a major problem in the United States. It's currently estimated that 1 in 5 Americans will be affected by skin cancer during their lifetime. That's about 1 in 29 men and 1 in 40 women.
That's incredible. And what should we be doing as far as taking care of our skin? You know, we've heard about sunscreen and things like that. What should we be doing, you know, on a daily or monthly basis?
Absolutely. So we'll start with on a monthly basis. I always recommend that my patients check their birthday suit on their birth date each month. So on the date of your birth each month, come out of the shower and take a look. Almost half of melanomas, the most deadly type of skin cancer, are self-detected. What you're going to be looking for is a new, growing, or changing lesion or mole on the skin, or a wound that doesn't heal. Often we talk about the ABCDEs of melanoma. So a mole that's asymmetric, has an irregular border, more than one color, diameter larger than a pencil eraser, and E, evolving, meaning changing, growing, bleeding on its own, or itching with no reason.
Yeah. What are the areas most prone to skin cancer?
So UV radiation, both from the sun and indoor tanning beds, are known risk factors for all types of skin cancer. So obviously exposed skin is some of the most at-risk skin. However, for patients of skin of color, they can get skin cancers in unexposed areas of the skin, like the palms of the hands, soles of the feet, inside the mouth, the private area, and even under the nails.
And we talked about, you know, that the monthly check-in, you know, on our body. What are some things daily that we should be doing?
So a great daily routine that's really backed by science is to use a moisturizer with a broad spectrum sunscreen. I recommend that my patients find an SPF of at least 30. If you're going to be outside, another thing to look for in your sunscreen bottle is water resistance. There's no sunscreen that's completely waterproof, so you do need to reapply every 2 hours, or if you've been swimming or sweating a lot. And the last thing is you're looking for the terms broad spectrum, meaning that it blocks UVA and UVB rays. The most important thing for my patients is that they love their sunscreen and will use it over and over.
And would you recommend too getting like your significant other or a family member or a friend or something to help you out? Because there's certain parts of it, like your back, your scalp, that it's tough. Like, I would never be able to see anything, right?
Right, absolutely. So if you do have a partner, friend, or family member who can help you check those areas. But the American Academy of Dermatology, or AAD.org, has tips for checking your own skin using a mirror on the wall and a hand mirror that can help you to see those difficult areas yourself.
Are we getting any better as far as education, and are people aware now of how important it is, or is there still work to be done in that department?
There's absolutely work to be done. I think that some of the messages that we've been good about getting out are things like the ABCDEs of melanoma, but maybe we're not being as proactive about letting people know that skin of color is also at risk of skin cancer, or that having a decreased immune system or a personal or family history of skin cancer can also increase your risk. So we need to get out to those populations.
I went to the skin doctor. I started going like 4 or 5 years ago, and they diagnosed me with carcinoma. And right off the bat, I'm like, "Oh my God, what's going on?" But that's something that can be cured. But it's just a sign of things you need to take care of your skin more, right?
Absolutely, and I hope that you're doing well after your diagnosis. One of the major points is that skin cancer of all types, even melanoma, the most deadly of skin cancer, is very curable and has excellent cure rates when it's caught early. I think that the problem that we face most is in some groups of our population, particularly men, they're less likely to use sunscreen, check their skin, and go to the doctor. So just doing those 3 common sense items in your daily life and taking care of the people that you love can really help to decrease the incidence of skin cancer.
Are there any common questions you get from patients, or maybe just, oh, I had no idea about that, or, you know, they're surprised to hear, you know, some of these things?
I think that one of the things that people find surprising is how much sunscreen they need to use to get the SPF number that's listed on the bottle. We've been pretty good about getting the SPF 30 number out there for people to understand, but that number is just how long you can be out in the sun and not burn. It really has nothing to do with anti-aging or UVA rays. So when I tell patients that it takes about 1 ounce of sunscreen, or the amount to fill a shot glass, to cover the areas of skin that are not generally covered by summertime clothing, they're usually surprised by that. And also the reapplication. We can sometimes see people put on sunscreen early in the day, but then not reapply, and still find that they're getting burns or tans by the end of the day.
Transition to skincare, because of course it's wintertime and our skin just gets like wrinkly and rough. And I mean, what kind of lotion do you think is best to use? I mean, even our hands, our feet, everything goes crazy.
Yeah, particularly here in the state of Maine, where the air gets dry and cold, and we turn up the heat in our houses, and all of that dries out our skin. So one simple thing you can do in your environment is have a humidifier, for instance, in your bedroom to humidify the air while you're sleeping. In terms of the best moisturizer to use, it's kind of like the best sunscreen. Whatever you use and will use all of the time is probably the best for you. In general, I recommend fragrance-free and very simple products. One of the best moisturizers around is Vaseline Jelly, which is affordable and has very, very low risk of allergies.
How important is it to hydrate when it comes to taking care of your skin?
So taking in water by the mouth is really important for general health, but more importantly for skin hydration is to lock in the moisture. So after a shower or bath, for example, dermatologists generally recommend blotting the skin to leave droplets of water on the skin that's still visible, and then to lock that moisture in by applying a nice thick layer of moisturizer.
All right, we have less than 30 seconds. How often should we go to see a dermatologist? And is there an age that we should start to go?
Those are great questions. Unfortunately, there is no recommendation from the United States Preventive Services Task Force about how often most adults should be seen by a dermatologist. Your individual risk has to do with your sun sensitivity, for example, red-headed or blonde individuals, those people who have a personal or family history of skin cancer, those people who are immunosuppressed because of medications that they're taking or treatment for cancer could be at increased risk. Also, those individuals who have more than 50 moles or very large or unusual moles may be at increased risk. So I'd recommend talking with your primary care physician about assessing your individual risk.
Is there a website that we can check out to find out more information and some of these things that we can do to be proactive?
Absolutely. My favorite website is the American Academy of Dermatology, or the AAD.org. And there's a wonderful patient-facing website that can teach you how to do skin self-exams, teach you about what to look for, and also emphasize some of the messages that we talked about this morning.
All right, great information. Appreciate it, doctor.
Yeah, check your body at least once a month.
Yeah, I have my daughter check out my scalp all the time. It really helps out. Yeah.
That's wonderful. Hairdressers are also wonderful for
that's
this.
a good idea, too.
Thank you so much for your time this morning.